Now we know what person who's passed DM wants to do fellowship for. Let's hear the views from the program director. I call upon Dr. Mohan Biyani for the same. I request Dr. Prabir Rai Chaudhary to stay on the panel, Dr. Ajay Kher and Dr. NP Singh to please join the panel. Thank you, Dr. Shruti. Over to you, Dr. Mohan.
Hello, everyone. It's nice to see some of the colleagues up here and back in India. I was going to go through the program director's view about nephrology fellowships at University of Ottawa. Just to give you a brief background, like I trained back in late 1990s and then went to Canada for a year or two. I thought like I'll do some kind of a disease donor transplant fellowship, come back, or like do some home dialysis. And over time, like things kind of looked so well and they looked so different. Like I was able to kind of rediscover myself, like as a nephrologist, like it was kind of a very kind of an enlightening way to kind of look at nephrology in a different perspective. So, like what I wanted to cover today in this brief, like 20 minutes or so, what we will talk about is the pros and cons, like what are the, about doing a fellowship outside India, what we offer at University of Ottawa training program, and then like part of it is covered by Dr. Bhasin about the subspecialty programs, like what we are offering, and then application process in a brief kind of thing. So, like with regards to the pros, like initially, like we had been kind of talking about like how important it is to go and abroad and get a different perspective, different view about like how nephrology is practiced, and also rediscover yourself. Like you don't know like until like you find like there are these options which you have out there, which can help you to kind of like develop a new passion or something. So it gives you an exposure of nephrology in a very different perspective, like in the Western world. Like it gives you also like an academic exercise, and like at our center at least, like what we do is we treat our fellows at par at the Royal College Fellows. So they are not differentiated at all. Like they go through exactly the same similar training what the Royal College Fellows would go. And along the way, we kind of assign them some research projects. Some people are interested to do some qualitative research or some kind of clinical research, or we do have like a strong basic science research as well. Like so, like if like you want to do some of that, like we do have we can offer that during that fellowship year as well. Then you kind of also, we encourage them to kind of attend different meetings, present at these meetings, like at ASN, they become part of Canadian Society of Nephrology. And these are fully paid fellowships. So like as we alluded earlier, like most of the fellows would save some money out there. Like so they have chance to do those extra calls kind of thing. And like working in India and going abroad there, like really it is like not a very kind of like hard fellowship, like in that way, like call burden wise or clinical load wise. Like our clinical load is like 10, 11 patients in a half a day clinic is like, oh, it's too full kind of thing. So it's not like really like when we see, and some like of the colleagues I talk here, like 110 patients in that day kind of thing, it's not the same. Like, so you kind of like really can work that extra call to like if you want to kind of earn a little better. Like there are cons as well. You are away from the home, like it's a new culture, new environment. So you need to kind of rediscover, like look at those kind of things. Like we mostly are gone on e-charting now. Like our most are like we have lost like our habit of writing at all. Like we're doing all like the dictations are done, and so we don't. As alluded earlier as well, like if your spouse cannot most of the times like is unable to work or something, so you are either leaving her back home here, or like if you're bringing with you, like she may not be able to do what like in her field any fellowships or so. Most of the times it happens that way. With regards to the children, like children might be able to kind of have that exposure for a year or two, but then they are back to India when they come. So there might be a cultural difference as well. And big factor in Canada at least is the weather. Whether we do get like a harsh winter right now, like we're running into -5, -10, but like you can learn skiing, skating, like that can become fun as well. Like if somebody wants to kind of get into a new kind of thing, that you can develop like that winter, take that opportunity and learn new things as well. So what were we looking for from prospective fellows? Like the prospective fellows have to be interested, like strongly to, or a desire to kind of learn something new, like want to kind of like have like bring something new to the table. Clinical competencies, which we kind of like trained quite, and they are deceased donor transplant. We are kind of a center where we do around 120 transplants a year. Most of them are deceased donor. We are very strong home dialysis program. Like we run around like almost 220 to 225 home dialysis patients. Knowledge expansion, like there is a lot of rounds which we kind of like at least 3 to 4 each week the fellows are able to participate in. And then if there are research goals or something, we encourage them to be part of research projects. We have a lot of staff who have been trained in epidemiology and so on, so they can tag along them, like work on the database and get some research papers out there. So Ottawa is a beautiful city. It's around 1.2 million population. It's quite spread out. There are 4 seasons, like each one of the seasons are quite beautiful. I'm showing you the like a fall picture here. This is Canadian Parliament. As a program, like it's an excellent preparation for becoming an independent clinical nephrologist. We have a strong clinical group of people who can help you to kind of get a good clinical acumen. And the set stage for further academic training and research. Like if you want to extend, like from the first year you do a clinical fellowship and want to do a second year kind of thing, like it's quite flexible. We can talk it over through, like in the recent past, like we have at least like 3 or fellows who, like as we were saying, have prepared for USMLE and then moved on to went to good centers in US, and they're kind of being trained in US in nephrology. So like that is one thing. So they get a fully paid fellowship in Canada. They are preparing for US and then go to US and start kind of get trained and start practicing there. We have international leaders who are in the research, who are in education at our center. We have three campuses where we practice nephrology. The civic campus is associated with the Heart Institute. A lot of heart transplants is done, and they do quite a bit of acute care cardiology. So we get a lot of CRRTs and so on being happening there. Riverside is mostly the ambulatory care clinics. Like so, ambulatory clinic, we do home dialysis. And there are multiple subspecialty clinics we have developed. Like we have a PKD clinic with a huge database of around 500 PKD patients, and most of them get genetic testing. They kind of are getting counseling. So like we kind of started to do quite a bit of like a subspecialty fellowship as well. General campus is where we admit patient under nephrology, and there is a consult service as well where we kind of have some exposure for SLED and acute kidney injury. Like this is a new civic campus which is being developed. It is basically a 2.5 million cubic square feet new facility is being developed, and we are going to move there in next 3 to 4 years. So this is being developed as we speak kind of thing. And nephrology division is kind of going to be moving there. We'll have like around 80 dialysis hemo spots on this campus. So it's a high volume center. Like as I said, like it is like we have like around 1.3 million population which we serve across Eastern Ontario. Clinical exposure wise, like you get exposure as an inpatient consult service. Specialized clinics are like, I would say like quite a bit forte. We do like quite a bit like our GN fellowships. Like there are like over the last 3 or 4 years, we have been offering GN fellowship. We will have a very strong renal path as well. So we kind of have those rounds on a like every couple of weeks basis. Where the biopsies are reviewed and fellows can participate and present as well. Apart from these, we have an renal hypertension unit where like it is recognized by American Society of Hypertension. We have been offering this fellowship for quite some time. One of our leaders is Dr. Rizika, who has been like working on sympathetic nerve hyperactivation and hypertension, and he's been there in the field quite well known. Pregnancy as well. We have a couple of experts who are like pregnancy and kidney disease. So we do kind of do clinics on every week basis. Apart from that, the conservative care clinic where patients who decide not to kind of do renal replacement therapy or so can have a conservative care approach as well. So kidney transplant clinic, if somebody wants to do a transplant, exclusive transplant fellowship itself, we do offer that. It is recognized by American Society of Transplant as well. And we already talked about these clinics. So like we have 730 prevalent dialysis patients. We offer SLED as well as like around 100 to 110 CRRTs every year. As I said, like transplant-wise, we are doing transplant on 100 to 110. Most of them are deceased donor and follow almost more than 1,000 transplant patients in our clinics. Most of our home dialysis patients are home PD. We do like something unique is kind of buried PD catheter. So patients who are kind of closer to dialysis within 6 months or so, they will get a PD catheter and they are left buried. And when the time comes to kind of start dialysis, they will just unbury and start them on peritoneal dialysis. A typical fellowship year, this is how it will look like. So the first 2 months are basically warm up, like we do kind of just like there are no calls here during the first month or two. Then as fellows get comfortable around the surrounding, they become comfortable with the e-Epic, the e-health thing. Then they are started with some exposure to inpatient service. They get couple of transplant months, couple of home dialysis months, and then rest of them, and this is kind of negotiated, we can talk to the fellows, see what their interests are. So the rest of 6 months we can negotiate and have them in different clinics kind of thing. As soon as they come, if they come in summer, we run a summer series for the new fellows, like a basic talks kind of thing. And then they have different kind of opportunity to present themselves or be part of these rounds, like Tuesday afternoon fellows round. We do Friday morning different rounds, which are journal club, evidence-based nephrology, or clinical case presentation. Biopsy rounds are done quite regularly. We have active participation from the pathologists. Nephrology grant round. This has been after COVID. This has been something which has been quite unique now. We are getting leaders, world leaders from across the world. One of our colleagues, Dr. Hermath, he's quite into social media. You probably guys have heard about him. So he's kind of getting all the world leaders to come and give us a talk. And so that is on the YouTube channel. If somebody's interested to kind of look at those, you can have a look. And so this is the channel which is from Ottawa Nephrology. There are a lot of videos which have been from the past talks. They are wonderful. There's a lot of information from like world leaders in their individual fields. So as I said, like in the second year, like we can offer subspecialty fellowships like transplant. We have critical care nephrology, hypertension, GN, hemodialysis, and home dialysis fellowships which can be offered if somebody is interested in that field or so. Kidney Research Center, that is quite unique. That is from Ottawa. We have like basic science lab, which we have like almost more than $10 million funding from different funding sources, and almost 75 to 80 publications in a yearly basis. We just don't study, we do have fun as well. So there is summer meet and greet. We do have some staff versus fellow Jeopardy, fellows retreat, and we do when meet at ASN as fellow, we meet at ASN goes. So as I said, like we'd go outdoor adventures as well. If you are interested in something else, like during winter time, you can be part of some different activities during winter. So it's a good place to kind of thing. So it's a perfect balance, like with regards to it's a large academic center, which will give you a quite good patient exposure wise. And there is like national leaders you can work along with. And along with that, like you have a good opportunity to be part of academic endeavor. The process itself is a little tedious. It takes 6 months or so. So like the first thing you need to do is basically show your interest with a CV and 3 references, and then we can guide you through the process. It's not like it's just time consuming, but like it can it can be done without any kind of major hassles or so. We started this back in 1999. So we just recently completed our 25 years. We had a celebration. Around 100 fellows have been kind of trained in our program. We offer around 5 to 6 trainees, like we have spots for. And and the fellows who have been trained, they have gone back to their home countries and become leaders in their individual fields or so. So if you have any questions, like I'll be happy to answer now or later, but I will encourage everyone like to kind of at least spend some time abroad before they kind of settle down back in their long-term.
I think everybody wants some questions from the back seat, mainly the students. This is the best time to ask questions to people who are actually into the job. Of course, we do have in the end, again, a chance to mingle around with these mentors. But one sad news is that the tea break is cancelled because we are 15 to 20 minutes late. And people who are in urgent need because the nicotine levels have gone down can quickly grab something and come. But we would want to continue because we are almost 15 to 20 minutes late.
Unlike American system, you don't have a matching system, right? They can directly apply. You don't need to go through that matching process. You can apply directly to the program and with that process, and most of them generally are successful, depending on the numbers. That's an advantage.
No, so one of the questions which I was hoping someone would ask would be, when you have multiple candidates and you're selecting a few, so what is kind of from the Canadian standpoint, and then we can ask Dr. Prabir Roy, from an American standpoint, as a program director, how are you rating and grading the fellow applicants on the paper as well as then on interview? So what is kind of the things that you're looking for in the candidate who you'll have usually 10, 15 and you're selecting 5?
Yeah.
Or in the match, how do you kind of evaluate the candidates that come?
Yeah, so that's a good question. Most our fellows who are being selected recently are like the fellows who have been recommended by our fellows who have come back here. So they know them, they have been working with them as a junior or so. So that is a big plus what we look for. Like, so so that would be one. The second is the references. And the third would be the interview process. How does it go? But like, I think most of the times what was happening now recently has been like we're getting the second kind of generation fellows who have been kind of recommended by our original fellows.
I can speak. So for the US, as was mentioned, you have to go through the match, although there's been discussion about whether we should or shouldn't be in an all-in match. Right now we are. So you have to go through the match. In terms of what one looks for, I would say that the interview process, which ever since COVID has been conducted virtually, is very, very important. And I would say that it's really important to be your own person, particularly if you're from outside and you haven't done a residency. I think you should highlight many of the things that actually Shruti said, right? You're coming here, you want to do it for yourself, you want to take back these qualities, this is what you have done. So being honest and truthful and being yourself is very, very important. The one thing I will say is that we did discuss earlier that this is a good time to come for nephrology fellowships even without a residency, but please do remember, as a program director in the US, you have to have 80% of your graduating fellows actually pass the nephrology board. So the one negative is that you don't want to take too many people in who you know are going to go back because you're not going to hit that cutoff. And then I have a question to ask.
Yeah, sure.
And it's a question both to you and to seniors in the audience here and junior people. There seems to be some sort of dichotomy in that we've heard that a general nephrology fellowship is really good in a way for people who want to go out and come back because that's what you do. But at the same time, from your presentation and similar to our program, we're trying to move more towards specialty areas. So the question to everyone is that for somebody going out from India, isn't it also worth doing a specialty fellowship, because then you have an interest. And as if you're thinking out 30 years in time, it's really important to have a niche area that you can put your hands around and say, this is mine.
Yeah, that's an excellent question. In fact, what is happening over the last 3 or 4 years at our place at least, we have been offering first year subspecialty fellowship. Like, so they don't have to necessarily do a clinical fellowship, like unlike Toronto. Toronto like would want it, but now in our center we can offer them directly transplant fellowship or GN fellowship without having them to do clinical fellowship.
I think it's important to have a mix of the both. That in first 6 months having to go through the system to understand the system, so general nephrology can be there, and then their own choice, if possible, to get it. I think I agree with him, because the training in most of the even private centers is so good that the only way that you can expand your knowledge is to have more experience of the other nephrologists. But
Chaudhary, is should we be wanting subspecialty fellowships? I agree to that, but then our problem is, again, you have a Society of Interventional Nephrology now, but they don't allow our fellows to go there for hands-on programs. And even if they go to which does not get them a certificate or something to come back with.
Right. I think it's other than, so I think if you do a fellowship, it has to be through USMLE. I mean, you have to have, so you have to have the USMLE and then do the clinical fellowship. So that's what, and even for interventional, if you have the USMLE, that's something potentially you could go for.
So I think the bigger and more important thing is having clarity in mind. What are you going out for? So if you're going out for learning how to do interventional nephrology, you can do it in India. There is Avatar, there is lots of internal programs that will have lots of volume as well. And many of the Indian programs will have much higher volumes than any US program will ever have. So that is one. Second, the advantage with going to the US and doing a training program there is that you have time to think, you have time to reflect, and you have teachers who will train you on that as well, which is, I think, where the perspective difference is, I think, key, where if you go to a training program, the mandate as well as the focus is on training. Whereas in India, you might be in a training program, but the training program's focus is on taking care of patients and making you take care of patients and not on the actual training itself. And so that difference can be a big difference. So even if you want to go and learn interventional nephrology and they don't give a certificate, if your goal in your mind is I want to learn it, I want to do it well, and then I want to come back and use it, it might still be worthwhile